As much as the government set up the Covid-19 Emergency Response Fund to mobilize funds for combating the impact of Covid-19, it does not reflect in terms of providing certain provisions, be it to the citizens or to the healthcare workers. So we did some participatory videos in an informal settlement of Nairobi known as Mukuru kwa Njenga, and we interviewed women asking them whether they received any financial aid or food aid from the government, and most of them had not. The situation over there is that the area chiefs are usually given the food aid to distribute amongst the poor people in the community, but they do not, the food does not get to the intended beneficiaries. So you'd find that they're distributing food at 3 a.m. in the morning, and women would not leave their houses at that particular time to go and fight with young men for food.
The biggest challenge that we've had so far, especially when we were conducting the research, is actually getting the data of how the government has spent the money. As I said, it was easier for us to get the data of how much has been collected or how much has been allocated, but for us to get the data of how the money was actually spent. And then the second thing was actually us to verify the data. We know that people have been talking. We talked to teachers, we talked to communities that were in the social cash transfer. We talked to healthcare workers, but some of them were actually pretty scared because in the past there have been cases where people had been arrested for saying the truth.
Given that Cameroon has not yet signed the action for the Freedom of Information Act, so we just focus on the government for information. So we plead for government to give us daily updates on how they spend the COVID money, so that we can also rely on these updates to make our work better and more concrete for our dear citizens.